I was nodding my head at a lot of the challenges that I heard from everyone else, and I can say ditto to every challenge that I heard. How many of you work with your deans and your faculty trying to get them to work across schools and disciplines? Yeah, so good number of you, because as Associate Provost, this is part of my job, is to help that facilitation, and my background is as a physician. I grew up in a medical school, running educational programs. I was Dean for Education at our medical school, and then 9 years ago was pulled kicking and screaming into the Provost office. But it's been wonderful, and actually the global health work at Tufts actually has been going on for decades. But it became clear that with all our different centers and programs and degrees, that there needed to be some kind of coordinating body. So what I'm going to talk about is, if I figure out the right button, is that we formed a Global Health Council last year, and there was a big discussion. Should we create a center? Should we create an institute? There were so many international centers already. We did not need another center. And so the decision was actually to create a Global Health Council, which I was elected to run, and by the Provost. So we just launched it last March. The number of faculty and staff, it was hard for me to answer that question because we're really dealing across the university. And all the other questions that everyone else answered, I said yes to everything. And the legally registered operations, we have just two. One in Ethiopia, where we're doing nutrition research, and the other is our European Center in Tel Loir, France. Some of you may be aware of the Tel Loir Network, which started several years ago by Tufts. It's an international association of higher ed institutions focused on social responsibility and active citizenship in higher education. We feel that as long as our work is being supported by our partner institutions, it's better not to have all these legal entities across all the countries that we work in. Thus far it's been working, but again, it's really on an as-needed basis. I wanted to just give you a background in terms of what our global health aim is. Because when we're talking about enabling systems, you have to ask, what are we enabling? The enabling systems are for what? And so when we spoke to our deans across our schools, I asked them, what are you already known for? What do you want to be known for? What do you think your key strengths are? And there were key themes that came out from all of those statements from the various deans. And what we came up with was that our faculty really do a lot of on-the-ground work. We really work with local communities trying to find sustainable solutions. And the participatory there stands for that community engagement. Working not only with an institution, but with the communities that they serve. And we use transdisciplinary to emphasize the fact that we're working across multiple disciplines and pushing innovative research and transformative education, which was mentioned in the plenary last night, and active citizenship, which is really a deep part of the culture at Tufts. I'd like to just introduce briefly some of our schools. Tufts is relatively small. It's only 10,000 students. We have 7 major schools on 3 distinct campuses, heavily health sciences based. We have our Cumming School of Veterinary Medicine. They're an expert resource both in zoonotic diseases and wildlife medicine. And Haley DeVos had mentioned One Health. And our veterinary school really thinks about shared health among animals, humans, and the environment. And they're terrific at bringing in all this expertise, working with participatory epidemiology techniques. And those techniques actually were used starting in the 1980s to develop and disseminate the rinderpest vaccine, which has essentially wiped out rinderpest, which is a plague of cattle in Africa. They also use it to manage avian flu, and that expertise led to their participating in a major USAID Respond initiative that's part of the Emerging Pandemic Threats Program. And if you think about livestock, it's not just the animals themselves as food, but their livelihoods for these communities. And it goes hand in hand with our food security, that's our expertise, or our Friedman School of Nutrition Science and Policy. That includes our Feinstein International Center, which deals with nutrition crisis management in really some of the most difficult places in the world. And also our Jean Mayer USDA Human Nutrition Research Center on Aging, which does the genomics, the micronutrient research, the bioavailability markers, et cetera. And together, they are active in these public-private partnerships in over 60 countries. So the amount of work we're talking about is quite considerable. Then you have our dental school, which works in very rural areas in public health as an entree into sustainable community development, and working on education training for healthcare worker pipelines, resulting in overall improved health. And then we have our medical school, which does a lot of work in public health. Again, they do a lot of education and training work. And actually, I'll be speaking on a panel tomorrow on some of our educational innovations. We help institutions develop enterprise systems that can serve entire regions. And it also includes mobile technology. And the Masters of Public Health program, which is run through the medical school, provides joint programs with our veterinary school, nutrition school, dental school, etc. So these can be all joint programs. And that's another venue where all our faculty and students come together. We then have our engineering school. They have expertise in water security and monitoring, which very nicely complements our infectious disease work. They have a water system science and society program, and was recently awarded an NSF IGERT grant in water diplomacy, and that brings together engineering, diplomacy, and economics for detecting, treating, and monitoring waterborne disease. And then finally, we have our Arts and Sciences School and our Fletcher School of Law and Diplomacy, which some of you may be familiar with, and they contribute expertise in culturally informed social and economic development, early education, conflict assessment, environmental policy, public and nonprofit management and leadership training. And you can think of all of the above as health as a bridge to peace. And so when I think about all of these different schools, all of these different programs that have been going on for decades, what we're trying to capture with this Global Health Conference is how do we leverage, how do we harness all of this energy, all of this expertise? And what we're trying to do, and I heard this theme come up in others, is building depth in regions. So we have, each of our schools working in different parts of the world. So, how can they start bringing in the other schools into the work that they're doing? How can they bring the other schools into the specific institutions that they're working with? And then as part of the Global Health Council, we're identifying where we can improve our infrastructure to support that cross-disciplinary work. And so, all of those wonderful charts that other folks showed, we're working in all of those areas as well. So in terms of the structure of the Global Health Council itself, you can see we have school representatives, and not just from the major schools, but for instance the Feinstein Center, even though it's part of the Friedman School, and also the Jean Mayer Research Center, again because it's part of the Friedman School, we actually gave them additional representation because they do so much global work. We wanted to make sure we captured the kinds of needs, special needs that they have. And we have the Provost Office, Advancement, Communications, and Administration. Same thing, you know, HR, legal, you know, all of those issues that come up, you know, we are working together to try to solve those problems. And then the working groups, those working groups are targeted depending on the kinds of issues that the schools feel are most urgent. And for communications, this one is it was interesting, out of all of the possible issues that folks brought up, unanimously they said communications was the #1 issue they wanted the council to address. And so we're putting together a database back end for a global health website so that everything, all the resources will be fully searchable. So the institutional context, you know, I think it's important to note that, you know, we have a history of a collaborative culture, matrix organization, and what we're trying to do is, you know, look at where we can take advantage of school-based management and university-level coordination. So in terms of helping the dean's work, there are multiple councils where they share information, strategic direction. This is where the president actually asks them, what are you doing together? And I have examples of the deans actually getting together to do joint faculty appointments and hires. They have research days on each campus sponsored by the deans. In terms of getting the faculty to work together, we have multiple programs, not just seed grants, but educational programs where faculty from different schools come together to lead courses. Our academic leadership development program, which is targeted to chairs and directors. We're now in our 3rd year of that program, and I can't tell you the amount of collaboration that has resulted just from that single program. It's been incredible. And I think some of these other things other schools also have. And for the administrators, you know, I think, again, very similar to other schools. And one advantage we have is our executive vice president actually has volunteered herself for several years in a remote site in Zambia. So she knows firsthand how difficult it is to work in these environments. And so her her administrative excellence program really is very informed by her own experiences. And so it's been fabulous for both the provost side and the administrative side to be working together to try to improve our systems. So I mentioned, you know, building this website. We are leveraging some of our major grants, both our IGIRT and our USAID Respond grant, finding ways of bringing other schools into those projects. Some other folks mentioned open educational resources. Don't have time to talk about that, but it's another wonderful offshoot of this type of work. So key challenges, people. You know, the administration, with administrative issues, and certainly the student preparation that Donna just mentioned, very similar problems. So the lessons learned, you know, I think we're fortunate, I think, to have the right mix of schools and size. Yes, you can invest in infrastructure, but the key, I think, is really investing in the people. Find those facilitators, and you all have them. Who are the people who can help you speak the language between departments and schools, and send them to leadership training. It's worth the investment 10 times over. And they can help you develop those processes that will stimulate that collaboration across the schools. And that's all becoming part of a learning organization where all of you are working towards that same goal. And just end with, this is a photo in one of our sites, Sheila, where it started with oral health, non-traditionally, but moved to water, clean water. Economic development, microfinance, and these bricks are to build a maternal child center, and we're bringing in the veterinarians to help with the livestock. Thank you.